That's why it took so much time.
Yeah, this software is good. Okay, so right now, this 48 white female who present with recent rapid onset of shortness of breath and rapid heartbeat palpitation. Okay, this occurred
40.
without warning and the regular rhythm resolved spontaneously, and she lost 12 pounds. Okay,
Mm.
her vitals, blood pressure is 148 over 90, pulse rate is 110, respiratory 24, temperature is fine. Okay. So she says that she's having trouble getting to sleep. She denies constipation and stuff, denies any heart intolerance. Notice decreased duration of her menstrual cycle.
Mm-hmm.
She thinks that yeah, thinks she's reaching menopause. She's 48, okay?
Mm.
So past medical history is nothing uh, ex- except for an anxiety disorder. She has no known allergies. The patient is sexually active with husband. Condom or contraceptions. No smoke, no alcohol, no IV drug abuse. So you don't need to consider on that. So now she presented to the office. What do you do for her?
Good. I'm going to do a full exam on her.
Okay, cool.
Because anybody who comes to the office, you're supposed to do a full exam on them.
You want to do genital, rectal?
Yeah, because
No.
she said she had some problem with her menstruation. Why not?
Yeah, okay.
So everything. Tell me her eyes, tell me her thyroid, tell me her abdomen.
Yeah, her hands are warm and moist. Diffuse non-tender enlargement of the thyroid is noted. Rest of the exam completely normal, and she has rapid speech.
Okay.
Everything else is normal. Okay, so what do you do right now?
So I'm going to start off with CBC, CMP,
Yeah.
UA, TSH.
EKG, urinalysis, yeah. TSH, you want to do TSH?
Okay. No, I have a mnemonic. That's why I'm going in that order. Okay. Anyway,
What is it? What is
T.
the mnemonic?
I use CCCUT cut, gleam, GLEEM.
What is
So
that for?
CBC, CMP, HCG if it's a female, chest X-ray, UA, T for TSH, gleam, G for glucose finger stick, L for lipids, E for ESR, E for EKG, M for magnesium phosphate.
Okay, is that you do it for anyone with the
I do it
office?
for
Huh?
everybody. It's a non-invasive. Most of them are non-invasive, and you can draw blood. Once you draw blood, it doesn't hurt it.
Okay, so you can give it to me. Okay, CBC,
You
what
cannot
else?
CBC. I do CMP because CMP you get LFTs included in it.
Okay, sounds good. What else?
Chest X-ray, UA, T for TSH. So that's CCCUT cut, right?
Yeah.
And then gleam, G for finger stick, like glucose finger stick, whatever. And then L for lipid profile, E for ESR, E for EKG, and M for magnesium and phosphate. I check magnesium phosphate on everybody, just for the heck of it. I
Okay.
mean, you don't lose points for that. It's like,
Yeah.
you know,
Okay. So I need to do T3, T4.
yes.
Okay.
And then I'm also going to do pregnancy test on her because she was also a childbearing,
Yeah.
kind of, I guess. You don't do portable in the
Yeah, yeah,
office.
pay lateral. Yeah.
Urine qualitative.
Okay.
This software is faster.
Yeah, yeah, it's cool. Okay, so what do you want to do right now?
We're gonna check the results.
Yeah, do you want to send her home or?
Oh no, I'm gonna keep her for at least 2 hours and get her TSH and figure that one out first. When is her TSH coming?
No, okay. Let's see when it's her TSH.
No, TSH is coming on day 3? No,
No,
it's coming
on
at
day
12,
1. Let's see, 9:40. Let's see,
so
9.
12:15. So move up the clock 3 hours because that I need that TSH before I send her home. So it's okay if she spends 3 hours in the office. That's okay. Glucose is good. Negative.
Negative.
EKG good.
Shows sinus tachycardia. The EKG shows sinus.
Yes. Oh yes, sinus tachycardia. Yes.
Okay.
Urinalysis is probably not gonna show anything.
Yeah, prognosis is fine. CBC is fine.
X-ray is fine.
X-ray is fine.
So you just need to give me the magnesium is okay.
ESR is fine. So the TSH is low.
Uh-huh.
Okay, it's 0.08.
Okay, good. So now I can stop the clock. Well, what about T3, T4? Well, that we don't. TSH confirms
T3,
that
T4
she's
is high.
okay.
Yeah. So what
So
else?
I'm gonna give her she has hyperthyroidism. So
Okay.
I'm gonna give her medication for hyperthyroidism. I'm probably gonna put her on methimazole.
Okay.
And
Propranolol.
propanolol for the symptoms.
Okay.
And then I'm gonna tell her to decrease. I mean, I'm gonna counsel her at the same time.
Yeah.
And I'm gonna also tell her the side effects of medication. I think methimazole has some side effects, right?
Yeah.
Agag side
And
effects.
let's do radio iodine uptake. 24-hour radio iodine uptake.
Oh, to confirm it. Good idea.
Okay.
Hmm.
Because this is gonna tell us some good information.
In case if it's
Yeah.
great, the
Anything else?
thyrotoxic.
Anything else?
I think I'm okay for now.
No. Okay. Sounds good. So methimazole.
Oral.
So what do you want to counsel her on?
Mm, I don't know. What did it say?
Compliance,
Medication
adherence.
compliance, adherence, yeah. Mm, side effects of medication. Right, yeah, right there. Okay.
Yeah, that should be fine.
How do you do that? You hold control button or shift button?
Control.
Okay.
Yeah. And then 24-hour radioactive iodine uptake. Maybe I should write it 24-hour.
I think it was there.
Let's see.
I think radioactive iodine was there. It was like towards the end. Or you could just type in RAIU. Maybe. Right there.
This one?
Radio iodine scan, yeah. Isn't that it?
No, this is testis.
Oh no, it's not. It's so tiny I can't see, sorry.
Yeah.
If you do RAIU, will it pick it up? Oh, there it is. Radioactive iodine uptake. Underneath radioactive iodine.
Okay.
You see it?
Yeah, yeah.
Right there, yeah.
So what else do you want to do? That yeah, that should be fine. Okay. Okay. Now we just follow up with her.
Send her home
Just when do you want to see her?
in 2 weeks.
Yeah, 4 weeks should be fine.
Why? Okay.
Yeah. Because you gave her everything, you know the diagnosis. This radioactive is just gonna confirm.
Okay.
So the radioactive iodine is increased. So now you got their diagnosis, right?
Like increase, like does she have Graves?
Yeah.
Okay. Diffuse uptake.
Yeah.
Okay, good. Patient does not
Yeah.
feel well.
No, 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 about what's going. So now she came. What do you do? What do you want to do?
I am going to uh check. Well, we can't even do physical
Let's do
anymore.
CBC one more time, okay?
Yes, to make sure. Yeah, good idea. Um,
What else? Let's
should we
do
take her
radio
TS?
iodine one more time,
Why?
just to see the uptake if it's decrease or something like that.
You should type in radioactive.
Okay, radioactive.
And what about giving her vaccinations this time?
Let's look at her age. She's a 48 years old.
We're
So
gonna give her
yeah,
influenza vaccine.
yeah, influenza. What do you want to do? Some screening for her?
No,
Hmm. Let's do pap smear.
pap smear. Pap smear, yeah.
Mammogram. Do you want to do mammogram?
Yeah, we can do mammogram. But that's at 50,
Yeah, it's
right?
at 50. Yeah, so it's not that. We'll give her
Mm.
calcium, vitamin D.
What
Multi-
else does she need? You can tell her to avoid caffeine, avoid anything that's gonna give her heart rate high.
yeah.
I think that's it, right? I think we should be good to go. Was that good? Were you double checking?
Yeah, 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 yeah,
Okay.
yeah, yeah. So I think now this should be fine. Yeah. So,
So,
so what do you? How do you summarize this case?
so basically, the way we summarize it, that the patient came in with signs of hyperthyroidism. So for us to um, figure that one out, we have to order her TSH levels along with other tests. So our TSH is going to show us that it's low, and we need to treat her for that, like we gave her methimazole. We also need to confirm that by ordering the radioactive iodine, and which also comes back as high. So it confirmed our diagnosis. And then when we send the patient home for 4 weeks, we call her back after 4 weeks and we check her CBC again and her radioactive iodine, and that will hopefully go down, and she should feel better.
So what are the? So when you have patients with palpitation, there are the high risk patient and there is low risk patient. Which one is high? Which one is low?
I think
Hmm?
the one with palpitations are high risk.
So the one with history of dizziness, family history of sudden death, arrhythmia, long QT interval, any patient with underlying organic heart disease, which include scarring from prior MI, cardiomyopathy, significant valvular disease, HOCM. Okay, these patients are at high risk of developing ventricular tachycardia, so should be evaluated for either ambulatory monitoring or inpatient electrophysiology study.
Mm-hmm.
Okay, and then there's low risk
Mm-hmm.
patient. Patient with no family or personal history of arrhythmia, no history of dizziness or syncope, no underlying organic heart disease. These patients should be reassured. However, ambulatory monitoring indicated if the EKG shows arrhythmia. Okay, that's
Mm-hmm.
what's most important thing. Okay, here you confirm the graves if there is a if there is a radioactive iodine. That's what confirmed graves. Okay,
Yeah.
so what other things do you want to measure in the graves?
Up, what else can I measure? T3.
Antithyroid antibodies, you can do it, but not routinely recommended. Like it's
Oh, TSH receptor antibodies.
yeah,
Yeah.
yeah. And the pregnancy test is very important before radioactive. If you do it without before pregnancy test, that's dangerous. Why?
That's causing radiation to the baby.
Yeah, radioactive is contraindicated in pregnancy.
Yeah.
Because you know radioiodine can cause destruction of the thyroid and associated with a small
Mm,
risk of
baby.
thyrotoxicosis. So
Yeah.
all elderly with a chronic medical problem, they are
Mm-hmm.
pre-treated with antithyroid at least 1 month before ordering that. Okay. So how do you? What is the definitive treatment for for Graves?
Definitive
Yeah,
treatment.
because you know this antithyroid is temporary, right?
Yeah. You have to do um radio. I'm not sure. Um, definitive treatment. It's not thyroidectomy, is it?
So this is how you manage it. This is very important thing. So
Okay.
you discontinue antithyroid medication 3 to 5 days before radioiodine treatment
Mm-hmm.
to achieve optimum iodine uptake.
Mm-hmm.
Okay. After you discontinue, then you give radioiodine therapy, radioactive ablation. Okay.
Mm-hmm.
And some physicians start tapering course of steroid at the time of radioiodine treatment if the patient has evidence of ophthalmopathy. Okay, so keep that in mind.
So radio iodine treatment is the definitive treatment for Graves.
Yeah. So radioactive iodine, when is contraindicated?
Pregnancy.
Yeah, also in younger than 20 years old.
Oh.
Okay, yeah. So PTU is the drug of choice for pregnancy, right? You know that, right? Yeah,
Yes,
so
yes.
essentially, yeah.
Only in the
So
first
what
trimester.
should you order before you order PTU?
CBC.
The liver
Oh, pregnant.
function test.
Oh, liver function. Okay.
Okay, that's it. So what is the definitive treatment for pregnant patient with hyperthyroidism?
Mm, um, I guess while they're pregnant, you can keep them on PTU in the first trimester and then change it to methimazole in the third trimester. And then once they give birth, then you can do the iodine. No?
The surgery, that's a definitive treatment. So you give them antithyroid till you do surgery and take it out.
You take out the thyroid in pregnant women?
Yeah, yeah.
Okay.
Okay. So how about if someone have asthma and have thyrotoxicosis symptoms? What do you give him propranolol still?
No.
What do you give him instead?
Hmm. Not sure.
I love it. Interesting. You see, medicine is interesting. There's always something, right? You give him verapamil,
Verapamil.
right?
Yeah.
You love medicine, right? Like it's interesting.
I love medicine. It's
Yeah.
very interesting and it makes sense.
Yeah, makes sense, right? Interesting. Yeah.
I like it's like a jigsaw puzzle. You put things together, it's a beautiful thing. It comes out to something beautiful.
Yeah, yeah, you're right. Yeah. Just gotta be careful when you mess up a patient. And there's
I
gonna be
know.
a lawsuit.
Mm-hmm.
Okay, so let's go to the next one.
Yes.
This kid is an outpatient. Oh, oh, sorry. So this is 2-year-old girl with abdominal pain and constipation. Okay, an outpatient clinic. She came to the
Three?
office. Yeah, 2 years old. Okay, okay. So present
Mm-hmm.
today, abdominal pain, constipation, anorexia. She arrived with her parents, who report her symptoms start slowly, at first with some anorexia, and then slowly they began to notice that she has constipated more frequently and
Oh,
had complained of abdominal pain.
sorry. Mo,
Hmm? Yeah, yeah.
I'm so sorry. I know you're recording. My daughter just woke up. Can I put her back to sleep?
Okay. Yeah, so we'll come back to this story of this little girl who had abdominal pain. Like once upon a time, there was 3-year-old girl who had abdominal pain, constipation, anorexia. She arrived with her parents who report that her symptoms started slowly at first with some anorexia and then began to notice that she has constipated more frequently, complaining of abdominal pain. Ah! Okay.
Mm-hmm.
The parents note that the patient's stool are normal in appearance, other than being somewhat hard and round. Okay, she had no episode of rectal bleeding or meningitis. She had no complaint of nausea, no vomiting, no, not regular medical care. She received immunization. She doesn't have any medical condition. Family live in a house built in 1930. They have been remodeling the house over the past year. and half including tearing down walls, finishing the floor. You got some idea, right, of what's going on? Let me.
Yes.
It's my phone's fell. Sorry. Okay, yeah. Feel bad, my phone fell. Okay, yeah. So now the house is still in its original windows, and the father works in the construction business. Okay, initial demolition prior to putting up a new structure. Mother stays at home and watches the patient. They have a school age child who's 6 year old of age. There are no pets. They have city water. The patient herself has never had trouble with constipation or anorexia prior to this time. The patient gross motor development is normal, and she's meeting development milestone. Okay, patient spend most of her time at home. She does not go outside or daycare. So what do you think? What's going on?
Okay, so at first I thought she was probably having constipation due to potty training. You know, some kids at that age don't poop, they just hold it. But then when you gave me the remaining history, I think it's lead poisoning.
Yeah, so this is how you. So patient with abdominal pain, anorexia, and constipation.
Mm.
Differential diagnosis is broad, and constipation is very common in pediatric population.
Right,
However,
right.
this child has some red flag that may make one want to pursue a slightly different course in the workup of her constipation symptom.
Mm.
First, she has not had routine health checkup, so she had not screening hemoglobin to identify iron deficiency anemia. Nor she has any screening lead to identify who are at risk of lead poisoning. Okay, so
Yeah.
you get two things. So both of these should be obtained in this patient as part of the constipation workup. Okay, due to this red flag because you didn't have any checkup. So let's go. Now she's in the office. What do you want to do?
So I'm gonna do a full exam on the girl, everything.
So she's well developed, no acute distress, pale conjunctiva normal, cardiovascular lungs normal, abdomen present but slightly diminished, belly is soft, non-tender. This there is she felt some in the left lower quadrant pain, some tenderness. Okay,
Mm.
neurologic is fine. She had constipation, so one would want at least to treat the problem first,
Mm.
and the order should include a bowel regimen to improve constipation symptoms. Okay,
Mm. Mm.
hypercalcemia and occult urinary tract infection may present with constipation, so you gotta be careful for that.
Mm.
Okay, so now you gotta be careful. So let's do your thing. What is it? Your mnemonic? Let's go.
CBC, CMP.
Yeah.
I'm not gonna do a chest X-ray on her, so I'm gonna do a UA.
Why you don't want to do
Yes,
chest X-ray?
because she's a little girl. I don't want to expose her to radiation.
Yeah, yeah, you're right
What
there.
am I ruling out? Nothing.
Yeah, yeah.
TSH.
Okay.
Um, I'm not gonna do a finger stick on her.
Why?
Lipid. Oh yeah, I should do a finger. Well, why?
Huh? Yeah, do
Should,
finger stick, lead, and glucose.
okay.
Doesn't hurt. What else?
Um, lipids.
Okay.
ESR. I think she's too tiny for that, but EKG. I don't know about EKG. She's too little.
Okay.
Magnesium, lead, phosphate. We're gonna do lead also.
Lead, calcium too.
Calcium, phosphate. Can we do iron studies on her?
Yeah, yeah. What happened? So what was your mnemonic? What is it? C cut?
Yeah, that's just something I use.
Huh?
I said,
Glen? Is it this one?
yeah, gleam.
N and what is N for?
I didn't say N, M.
Oh, for magnesium. Yeah, yeah.
Yeah.
You can add calcium. You can measure calcium here.
Yeah, yeah, I
You
mean,
want to give
yeah.
her something for constipation? What do you think?
I'm gonna give her. Where do you give kids for constipation?
You can give her Dicosate.
Doc, you said, yeah.
Okay, milk of magnesia. Okay, what else? Phosphate. We didn't say that.
Mm-mm.
Phosphorus.
Phosphate. We did lead, calcium. Okay, I was saying iron studies.
Yeah, yeah. I don't. Let's see. I like the CCS. Like, it's amazing.
Mm-hmm.
Make you a real doctor. Like, for real. Like, it's not like just treatment. What's the treatment? What's around it? Like everything.
Yeah.
Basically, make
I
you
think
a real
I
doctor.
think
Huh?
when you take the exam, you'll get a perfect score. You are ready for it. I don't know why you don't want to take it.
Me, yeah, because I always had this passion. I watched when I was in medical school. Like, I was struggling with these basic sciences and
Finger stick
stuff.
glucose, the
What
last
is
one,
what is it?
second to last. Yeah.
Yeah, but then when I watched Dr. Najib videos, it's really changed my life. Like, it made me really good basics, solid component, and made me love medicine. Probably if I haven't watched this video, probably I'm still studying for step one, something. So yeah, so I really wanna create these videos. So
Dr. Najib is like amazing.
yeah.
He
Have
draw
you have you
his
watched his
drawing.
videos? Yeah.
Yeah, I've watched it for step one. I've
Uh,
watched his not step one, maybe step two, like DKA video or even the neuro video, like where he teaches how the whole like limbic system works. Like I was,
he is like
what?
amazing. Yeah, he's like my mentor. Even I watched all of his videos and explained it to the other students. So that's why, like, now very imprinted in my head, like, very well.
That is
Yeah,
very good,
yeah.
Dr. Sodium.
So you watched all of his videos and stuff?
No, I only watched the free ones on YouTube.
I see.
Yeah.
But it's cool. By the end, like, he sold them very cheap amount, like $60 or something.
I don't even know. That was like I needed some conceptual knowledge and it was like popping up somewhere on YouTube and I'm like, oh, what's that? So I looked at it, I'm like, wow. I never forgot DKA after that.
That's true. Yeah. Okay. So
Mm.
now, what do you want to do? You want to follow up in 5 days, right? You don't
Yes,
want to keep her.
something
Okay.
like that. And did we do Venus blood? When we do blood, did you do Venus?
Let's do the
Oh, you
finger
did blood.
stick first. Okay, and then
Oh,
we do Venus lead level.
okay.
Okay, that's how you do it. So now the lead level is 70.
Uh-oh. That's
Hemoglobin
very
is
high.
10. Hematocrit is 33. MCV 76.
Hmm.
Okay, your analysis is normal. Everything else is fine.
So we're gonna call her back and now we're gonna give her Saximar. What do you give kids for lead?
Yeah, now first we confirm it, right?
Yeah.
How do you confirm it? Because we don't go with the finger stick glucose. Because
No, I'm gonna do Venus.
Yeah, yeah, so now we're gonna do this. Let her come back.
That's the one. Oh, it's gonna end your
Oh
case.
no, I think I should just try different. Okay, Venus lead level.
Mm-hmm.
Venus lead level. Okay.
No, you should type in
Hmm.
Venus lead, maybe.
Let me just write lead.
You
Let me.
already did that.
Is it this one?
No, you did that already.
So why is not showing up?
Venus lead. Did you try Venus lead? That's weird.
Yeah, I think it's a blood, the same one. Okay, so the Venus blood level is 45. What do you want to do right now?
Oh no, that's below normal. So nothing.
54. Sorry, 54.
So it's
So
less
it's
than
it's
that. So it's
elevated,
nothing.
huh?
What's no? If it's 40, you said 45?
54.
Oh, now, okay. You said 40 something. Okay. So 54 is elevated. Yes. Now I have to treat her with the lead chelating supplement or treatment. Is that what drug is it? Suximor?
So first you do home inspection of lead. So this when it's more than 45, then this is abnormal. Up to 69 we do chelation. But if more than 69 we do two drug regimen like Pseudomonas infection. So first you do home inspection for lead. Okay, what
So
else?
how do you type that?
Lead paint assay at home. That's how we do it. What
Can you
else?
see? Can I see how it comes up? Sorry.
Yeah, sure. Lead paint essay at home. See?
Oh, wow.
Yeah. And what else? Dietary recommendation. What do you want to recommend with diet?
I don't know. I've never done the lead case before. Uh, we have to give her chelating agent.
What happened with this one? Okay, just a second. Let me see. Close. That's good.
We can talk about it. It's okay.
No, no. Let's run this case. I like this software. Okay. So let's imagine like it's the same one. Okay. So
Hmm.
now, diet. What else? You wanna let's check ferritin, TIBC, and
You did.
you give her,
Oh,
huh? Yeah, we didn't do ferritin and TIBC. So what do you want to give her? What medication for chelation?
I don't know. Saxima?
Yeah, Saxamer. Yeah, good job. Yeah, good job. You have really good medical knowledge. Yeah, I think you're gonna be really good. You're gonna do well in residency.
Oh, thank you so much.
Yeah, that's what I think. Yeah. ESR.
ESR. Yeah.
What else?
We did ESR on her, but anyways, that's fine. This is like in the last 2 minutes.
No, no. Like the case, don't measure it on this case. It should.
Okay. Um, diet, I don't know what else. That's it. And then I'm going to counsel the parents, and then I'm going to give her vaccination probably for influenza. We give everybody influenza. Diet normal. What diet are you going to give her? Soft? High fiber? No. High iron. Hello? Hello?